Today, we're diving into a really groundbreaking treatment for a condition that is, let's face it, super common, but one we just don't talk about enough. We're going to explore how simple sound waves might hold the key to helping the body heal itself from a problem that literally affects millions of people.
So what exactly are we talking about here? It's called stress urinary incontinence, or SUI for short. And basically, it's when you have that involuntary leakage of urine during physical movements. Things like coughing, sneezing, even laughing hard or exercising. It happens because the muscles that are supposed to support the bladder, specifically the pelvic floor and the urethral sphincter, they become weakened or impaired. And just to give you an idea of the scale we're dealing with, this is not some rare condition. By 2018, it was estimated to affect 167 million people around the world. That is a massive number. This is a widespread health issue that touches countless lives, everywhere.
Okay, so before we get to the really cool new solution, it's so important to understand the problem at its core. Let's just take a quick look at the biology behind what's actually going on.
As you can see in this diagram, there are a few key parts that are all meant to work together in harmony. You've got the bladder, the urethra, and then these really crucial muscles, the urethral sphincter and the bigger pelvic floor muscles. You can almost think of them as a sling or a support system that's designed to keep the urethra shut, even when there's pressure. When those muscles get weak or damaged, that seal isn't as tight, and that's what leads to leakage.
Now, for a problem that's this common, you'd think we'd have a perfect solution by now, right? Well, the reality is a little more complicated. The search for a treatment that's both safe and effective has been a really big focus in medicine for a long time.
So right now, you've kind of got two main camps. On one side, you have surgical options, like mid-urethral slings. And yeah, they're often considered the most effective treatment, but they're also invasive and they come with some pretty substantial risks. Then on the other side, you've got these incredible regenerative ideas, like stem cell injections. But while the potential is huge, the research shows it's just not quite ready for prime time. One of the biggest problems is that the cells you inject often just wander off. They don't stay where you need them. So patients are often stuck in this tough spot between a risky surgery and a therapy that's still on the horizon.
And you don't have to take my word for it. This idea is reflected right there in the research. Doctors and scientists are actively looking for better alternatives. They're really driven by this need to move away from the complications of older surgeries and towards something that can truly regenerate the tissue.
And this is where the story gets really interesting. This whole search has led researchers to a completely different kind of approach. One that doesn't use scalpels, doesn't use injections, it uses sound.
It's called microenergy therapy. The technical term is low-intensity extracorporeal shockwave therapy. Now, extracorporeal sounds super complicated, but all it means is that the treatment is applied from outside the body. It's totally non-invasive. It uses these targeted low-energy sound waves to basically wake up the body's own natural healing processes, right where they're needed most. I know, it might sound a little bit like science fiction, but this is all backed by years of really rigorous scientific research. The journey to prove that this actually works was careful, methodical, and pretty revealing.
So this didn't just happen overnight. The whole thing started back in 2016 with a study on rats that first showed these sound waves could actually regenerate urethral tissue. Then, by 2019, they proved it worked in a more complex animal model. And all of that foundational work led to the big moment in 2021. A full-blown, randomized controlled clinical trial in humans, which ultimately confirmed that yes, this therapy is effective for patients. So what did that big human trial find? Well, the results were pretty compelling. The patients who got the real therapy had a significant drop in urine leakage compared to the group that got a fake or sham treatment. And this wasn't just based on what people said, it was measured objectively. But subjectively, patients also reported a real, noticeable improvement in their quality of life. Oh, and they also discovered that a longer treatment, 8 weeks, worked even better than 4 weeks.
Okay, so we know it works, but the million-dollar question is, how? How on earth can a simple sound pulse trigger such a complex repair process in the body? Well, the science behind it is just fascinating.
Let's break this down because this is the really cool part. What we're looking at here is the amazing process where a physical force, that sound wave, gets translated by our own cells into a biological command that says, okay, time to heal. It all happens in a 4-stage cascade. So here's the play-by-play. First, propagation. The sound wave just travels into the target tissue. Simple enough. Second, the physic effect. That wave creates these tiny little mechanical pushes and pulls on the cells. Third is mechanotransduction, and I know that is a mouthful, but this is the magic step.
It's where the cells actually feel that physical nudge and convert it into a biochemical signal. They're basically flipping a switch. And finally, you get the biological effect. Those signals kick off a whole chain reaction of healing and regeneration.
And a huge part of that biological effect is waking up something called tissue-resident stem cells. The best way to think about these is like your body's own dedicated repair crew, and they're just kind of sleeping inside our tissues. They're normally dormant, but they can be activated by a stimulus, like an injury or, in this case, a targeted sound wave, to wake up and start repairing and replacing damaged cells.
So what's the end result of all this? What's the end game? Well, the research points to 4 key things. First, the therapy wakes up those sleeping stem cells. Second, it actually triggers the regeneration of muscle tissue. Third, it improves the biomechanical properties of those muscles, their strength and their elasticity. And finally, it fine-tunes all the communication between cells to promote healing. It's a truly holistic approach to regeneration.
So what does all this mean for the future of treatment? Where does a therapy like this fit into the bigger picture of medicine?
The big takeaway here is that we're looking at an incredibly promising, non-invasive therapy that literally empowers your own body to heal itself. The results so far, from both animal and human studies, are really strong. Now, of course, the research isn't done. Scientists still need to fine-tune things like what's the perfect dosage or the ideal treatment schedule. But the foundation here is incredibly solid. And that really leaves us with this final, kind of provocative thought. We so often think about medicine in terms of what we add to the body, pills, injections, surgical implants, but this technology represents a totally different way of thinking, healing from within. So the big question is, could targeted energy waves that just unlock our own body's potential be the real future of regenerative medicine?